Everyone has something that they're insecure about, or something that they wish they could change about their body, or just their physical appearance as a whole. Body dissatisfaction is something that is often very discussed in women, but for some reason, it's not talked about nearly enough in men. Catherine A. Phillips, the director for the Body Dysmorphic Program at the Butler Hospital for Brown University, has gone in detail about this subject. She notes how the amount of men who are unhappy in their bodies has nearly tripled in the past 25 years. So why aren't more men talking about this if it's such a growing problem that needs to be addressed in our country? In order for us to go in more detail about what male body dysmorphia is, it is first required for us to define it. According to the Anxiety and Depression Association of America in the United States capital, Washington, D.C., body dysmorphia can be defined as a body image disorder that's characterized by persistent and intrusive preoccupations with one's imagined or slight defection in physical appearance. So what does this mean exactly in men? Some of the perceived flaws that many men have had include muscle mass, height, weight, or even genital size. These men will spend hours laboring over these perceived insecurities, and it never gets better no matter how hard they try. Men often compare themselves to supermodels, gym freaks, and people that they see on the cover of various magazines. We've all seen the infamous men's health magazines that claim that you need to have the largest chest, huge biceps, and a small waist to even be deemed attractive. These magazines are simply filling with lies because that is untrue for so many people across the country, and it is an unattainable body goal. Men face these body standards that we often think are only applied with women. Just because these male disorders aren't discussed as much does not mean that they aren't happening. And since they aren't discussed as much, it's often difficult for research to be done on this topic. Additionally, overworking at the gym and over-exercising so hard is a culture for many men. This often leads men to deal with their insecurities in other ways, such as using protein supplements and even in some extreme cases steroids to combat their insecurities. Feeling insecure about your body for many men is perceived as fragile, weak, or even demeaning to your masculinity, and that's simply not true. It's hard to get men to talk about this issue and diagnose it for that exact reason. However, once it is able to be diagnosed and men are talking about it, there are several treatment methods that often come in hand very well to help combat this issue. One of these sounds too simple to be true, but it is true. Sometimes simply body positivity and a positive role model in a person's life can have great effects. Again, it sounds way too easy to be true, but seeing confident people who look like you, act like you, but are confident in their self-image and their body can have great effects on you. It does not work in all cases, so in more extreme cases, other methods have to be used. One of these treatment methods is cognitive behavioral therapy, which is discussed in great detail by Susan McQuillan in 2019, who is a registered nutritionist for psychological communication. In this, patients learn to replace negative, unhealthy thoughts with more positive, healthy thoughts about their body and their way of life. It helps the patient understand that these negative thoughts are what's causing their disorder, and it's not necessarily a perceived flaw because the flaw is not there at all whatsoever. Another way with which male body dysmorphia can be tackled is by using antidepressants. Since one of the strong side effects of dysmorphia is depression itself, antidepressants come in hand very well. Antidepressants may bring relief to patients by helping them remove these obsessive compulsive thoughts in their head that won't go away. And it also tackles the negative behaviors that they're having by simply just putting them in a better mood on a day-to-day basis. Since it is such a strong issue that is up and coming, there are more efforts to bring awareness to this topic. People who are able to recognize these issues include coaches, gym owners, and personal trainers who are dealing one-on-one with the men who are overworking and over-exercising. They're present where these individuals are dealing with the issue so they can step in to help. Other people who are extremely important in this process are the friends and family of people struggling with male body dysmorphia. They may help them understand that their feelings are not weak. They aren't effeminate, and that talking about this issue is the way that they can really deal with it. There are certain symptoms for many friends and family members to look out for in a person. These symptoms include avoiding having their picture taken, over-exercising to the extreme and overworking at the gym, a constant discussion about their disorder. Many people who have male body dysmorphia constantly have these thoughts in their head, and it comes out in day-to-day conversation. People who suffer from male body dysmorphia also repeatedly change their clothes in dismay. They also avoid social situations in which they might have to present their body, such as just going to the pool, which is regular for many people. They also may suffer from other emotional disorders like anxiety and, as discussed before, depression. And they also constantly believe that others are aware of this insecurity that they're facing, even if others cannot even see the flaw because it is not truly there. The biggest takeaway from this is that male body dysmorphia is something that is extremely prevalent in our nation. It's under-discussed and it's under-researched, and it needs to be talked about more. It's difficult to diagnose, and the cultural stigma against it is what makes it so difficult. But hopefully, with the current body trends in positivity that we are seeing in a lot of mainstream media today, this issue can be overcome and it can be dealt with in a positive manner. It's an important topic for everyone to be aware of since it is so prevalent, and many of you may know people who are dealing with this issue themselves. Thank you so much for listening to what I had to say today.